Let's talk to Mike Buckley, he's a commentator and campaigner, and to Alan Miller, who's the co-founder of the Together Declaration. Thank you both very much for talking to me on Saturday morning. How are you keeping?
Good, thanks. How are you?
Doing all right. Great stuff. Mike, what do you make of this? What do you make of what Boris Johnson is saying he'll do? Obviously, we don't have all the detail yet, but it looks as if we'll be getting it very soon indeed.
Well, on the politics side, it's obvious that Boris Johnson is just trying to distract attention from the fact that he's under investigation by the police for breaking the law. And he seems willing to do absolutely anything to make that happen. But I think it's far too late for that. We all know what he did. And it looks like the Met are going to investigate that, and we'll come to conclusions, and we'll see what happens when that's made public. In terms of COVID, I was reading yesterday, there was quite a long piece about international reactions to what Boris Johnson is doing. And it was senior medics and scientists from Germany, from France, from New Zealand, Australia, the US, all of them saying, what is the UK doing? This is utterly crazy. Yes, we are moving out of the pandemic, or at least we hope that we are, as long as a new, more dangerous variant does not occur. But we're not at the end yet. This is going to endanger lives needlessly. We have hardly any COVID restrictions left in this country. Removing the few that are left, for example, enforced isolation for people who've got COVID, is just going to endanger more lives. And it's always worth making the point, we've got the highest number of COVID deaths in all of Europe, despite not having the largest population. The handling of the pandemic here has been catastrophic as compared to many other nations. It continues to be catastrophic under this Prime Minister who thinks of himself first and foremost, and really does not think of other people at all.
Okay. Alan, I would imagine there's probably quite a lot on that you don't agree with. Alan Miller from the #Together Declaration. What do you make of what Mike has said there?
Well, 23 months down the road and worrying about how things could be risking lives when we've got millions of people who are waiting for cancer, heart disease, stroke, everything from dental care and a range of other issues where lives have also been lost, where we've been singly obsessed with one issue to the detriment of all others, as well as having impositions and restrictions that have not been about engaging or thinking about how people can exercise judgment. As we know, pre-first lockdown, people took measures in their own hands and started isolating themselves. And as we know, when people are sick, they also are decent and they isolate. The idea that you have to have state impositions to do things is very wrong-minded, and is one of the consequences of the ideas of what we've had in the last 2 years, where it's become the idea that the state imposes these measures as though we're very naughty children. We've been treated with contempt and disdain, and that's why at the Together Declaration, we're going to have and insist on a proper full public inquiry where we assess and evaluate why the pandemic strategy was thrown away and jettisoned, and a new policy of lockdowns was imposed, never been done before. Why it was the case that by stealth impositions were made by Parliament. Mike talks as though somehow this has all been a really democratic discussion about how we all best think about how we do things. All these scientists and epidemiologists around the world commenting on the foolhardiness of Boris. Well, actually, it's the first time that the Prime Minister has done what elected representatives are meant to do, which is make decisions based on weighing up all the variables rather than just outsourcing it to others and saying the science says. And that's been a part of our problem.
Okay. Alan, I just want to ask you a quick question, which is just, we'll come back to you in a second, Mike, but I just want to ask you a quick question just about the mandatory self-isolation, because a lot of people, especially people who might be rushing back to work, people who maybe their employers put them under a bit of pressure to say, come on, you've had 5-6 days, maybe it's time to come back. Having that 10-day kind of breathing space, actually, some people have said that actually helps them get well after having COVID, which is, of course, for some people not a particularly serious thing, and for some people it's very, very serious indeed. Do you not think that kind of fact that it's mandatory, the fact that there is some sense that you can actually say to your employer, well, hold on a second, the government says we should do this. Do you not think that helps in some way, Alan, in terms of making sure that people are properly well before they go back to work?
Yeah, well, I think a couple of things. I think firstly, there's been a situation where work from home and people not going into work is still in existence, even though it's not formally meant to be, and that's been a big issue. And people being off for a long time has been an enormous issue. I think there's a couple of other issues as well. For instance, when people are saying they've got Omicron or COVID with asymptomatic testing, and people who are actually healthy who are not going into work or not being allowed to go into school, those things are still happening. So I think in the context of this, if someone is genuinely ill, and they are concerned that they are going to be spreading something to someone, then they take the measures and they are going to be sick, and they do that as they would do. I think that, that's the context about that. Okay. I just want to reiterate as well, just when we think about the damages now, the impacts, it's across the board. It's across education, it's across health, but it's also across the economy. And I really think this idea that somehow after 2 years it's being irresponsible to get back to normal.
Sure. Well, sorry to cut you off, Alan. I'm just very conscious of time. Mike, Alan's had quite a lot to say there. What do you make of what he's said, and what do you think of what he's putting forward?
Well, I mean, I'll respond to his first point. First, he first referred to the 6 million people, or possibly more, on the NHS waiting list. We all want to see that number come down. The best way to see that number come down is to keep COVID cases under control, so that people don't end up in hospital and hence take up beds and take up staff time. And indeed, give the virus to other people in hospital, or give it to staff who then need to take time off. If you want to help the NHS, you need to control COVID, which we're singularly not doing. We'll be doing even less, once the Prime Minister removes restrictions, as I said, in an attempt to save his own skin. In terms of the state imposing control, we live in a society in a pandemic which has caused, at least 160 or 70 odd thousand deaths. Of course, the state has to intervene. Of course, we all have our own agency, but certainly I hadn't lived through a pandemic before. We need guidance from scientists who actually do know their stuff. And of course, it's the responsibility of the government to keep us safe. They haven't done a particularly good job of that. But, Alan also mentioned people staying off work, people staying off school. They're doing that because infections are still at a hugely high rate. I mean, on the government's figures, it's about 60,000 a day. I was reading the King's College study yesterday saying the real figure is probably about 200,000 a day. 1 in 25 people in the UK have got symptomatic COVID. No wonder the economy is in trouble, because that's loads of people not going into work and doing their jobs. If you want people to go to work and do their jobs, you want them to not get COVID, which means you need to control infection.
Okay. Just very briefly, Alan, could you give us your final thought, because we're running out of time?
You'd be thinking that we were talking about the start of this pandemic at the moment, listening to Mike. Omicron primarily, as they said in South Africa, and as we've discovered and everyone has said, is far milder and actually far less virulent in many ways than the flu for many people. And we know every year the flu is a killer. Let's not be contemptuous of all the elderly and vulnerable people that die every year of flu. We do not shut down and lock down society in making positions where we throw away all the pandemic strategies we've had for many, many years. We do not do that because there is a thing that's a kind of a bad cold or far less than the flu. Okay. We should not have done it in the first place. And that's why we're encouraging everyone to put together a declaration and our full public inquiry. We will be holding elected representatives to account for these decisions and making sure there's clarity about why this, so we don't go down the same path again. Okay. And actually, I think it's fantastic that the world's looking at England in particular. And let's remember, Scotland, Wales still has draconian impositions. They still need to be removed.
Thank you both very much indeed.